Hi, my name is Eric Bachhacker. I'm a firefighter paramedic with the Castle Rock Fire and Rescue Department. This is my partner, Nathan Myers. He's an EMT basic and a firefighter. Today we're going to be performing a nasal intubation. First step is to make sure we have the proper PPE, glasses, and gloves. The next step is to prepare the patient. That involves explaining to them the procedure because they'll be awake during the procedure. Step one is to prepare the nostril. The first thing we're going to do is provide them the neosynephrine. You're going to do one spray, wait a few moments for the medication to take effect. This dilates the blood vessels in the affected nasal passage to reduce bleeding. Next, we're going to measure a nasal pharyngeal airway. Make sure it's the proper size for the patient and the procedure. Next, we're going to lubricate that nasal pharyngeal airway. Nate is going to insert the airway with the bevel towards the septum of the nose. He's going to insert it all the way and then use a bag valve mask to ventilate the patient at the proper rate and depth. Continuing with our nasal intubation, we want to prepare our equipment. We want to select the proper tube. We select the proper tube by measuring the size of the nares of the patient. The tube size should pass easily through the nare. Next thing we want to do is to form the tube for insertion. In order to do that, we can insert the end into the other end of the tube and create a ring. We want to do this using sterile technique. The last thing we want to do is lubricate the tube at the distal tip. At this time, I'm going to have my partner give 3 breaths in order to pre-oxygenate the patient. He's going to remove the MPA and prepare for insertion of the tube. Continuing with our nasal intubation, Nate's going to advance the ET tube straight back, slowly, not forcing it, and when he meets resistance, he's going to pull back slightly and rotate. When he reaches the back of the airway, he's going to stop and listen for breath sounds in the tube. You can consider using a commercial device such as a BAM for this. At this time, I'm going to encourage the patient to inhale and take a deep breath very slowly and deeply. Upon inhalation, my partner Nate is going to advance the tube all the way. He's going to inflate the cuff, attach a bag valve mask to the endotracheal tube, during ventilation, we're going to auscultate for breath sounds and over the epigastrum to confirm proper placement. If proper placement is reached, we're going to confirm that with a secondary device, such as capnography. We're going to secure the tube. And continue ventilation. This concludes the nasal intubation scenario.